and I'm sorry, but this has changed a few times. Sam Tornatore, representing DuPage County District 1 and President of the DuPage County Board of Health. Karen Ayala, Executive Director, DuPage County Health Department. Ron Nunziato, Nunziato, Extended Care LLC. DuPage County Board Chairman, Dan Cronin. And then back to Karen Ayala. Due to the fact that this is an ongoing response effort, we will following strict ground rules today. Following the last speaker, we will open the floor for questions for approximately 10 minutes. Please understand, we've been working on this response day in and day out for nearly 2 months, and our work must continue today and in the days ahead. Based on that, there will be no one-on-one interviews today. And finally, we have received questions about patients and facilities. Due to strict patient confidentiality guidelines, this is worldwide, questions about patients, where they are, where they have been, will not be answered. Please do not ask questions about patients. And finally, future updates will be provided as information is available. Please stand by. Sure, it's Ron, R-O-N, Nunziato, Nunziato, CEO, Extended Care LLC.
Good morning, everyone. My name is Sam Tornatore, and I serve the residents of DuPage County in District 1 and also serve as president of the DuPage County Health Department. First, I would like to thank all of you for being here, particularly our elected officials who have given of their time and their representation of their constituents. I want you to know that the DuPage County Health Department has responded to countless health outbreaks and concerns for 75 years. The members of the DuPage County Board of Health have been in constant communication with our health department and their team led by Executive Director Karen Ayala. The Board of Health will make sure that the health department has all of the resources necessary for this response. Thank you, and please welcome Karen Ayala.
Thank you, Sam. Excuse me. Yesterday afternoon, the governor announced the first confirmed coronavirus or COVID-19 case in DuPage County. DuPage County Board Chairman and I joined the governor for the announcement. To our current situation, according to the Illinois Department of Public Health yesterday, we now have 64 cases of COVID-19 in the state of Illinois. The case here in DuPage is a woman in her 60s residing in a long-term care facility. I'd also like to remind folks that there is currently no vaccine to prevent the coronavirus disease. As part of our response to this unprecedented and evolving public health emergency continues, we want to prioritize both open communication and transparency, as the safety and health of our residents is our utmost concern. The DuPage County Health Department itself has been monitoring and responding to this pandemic since late January. I am extremely proud of the work we have been doing to protect our clients and the residents of this community. While we have been working to contain the spread of this disease, we expected to see cases here. We have been talking about the eventuality of what happened yesterday, and we are absolutely not surprised, nor are we panicked with this news. The DuPage County Health Department continues to focus on the mitigation of the spread of disease, as well as working with our communities to prevent future spread. We've worked closely with schools, with healthcare providers, with community organizations, and others to highlight the simple personal prevention steps that are oh so effective in addressing this current situation of washing hands, covering coughs and sneezes, and above all, staying home when you're sick. I assure you, normal duties or COVID-19 duties, which could include our emergency call center or supporting our communicable disease and epidemiology team, backing up the web and social media strike teams, or other duties related to this ongoing situation, our staff are ready and are prepared as strong players in the this public health emergency. I would now like to turn over comments to Ron Nunziato, CEO of Extended Care. Ron?
Thank you. Good morning. My name is Ron Nunziato. I'm the CEO of Extended Care. Extended Care is the consulting company that works with Chateau Nursing Center in Willowbrook, and I am the owner's representative. As always, our residents' health, safety, and well-being is our highest priority, and we recognize the uncertainty and the concern regarding the rapidly evolving coronavirus disease, COVID-19, the outbreak both internationally and in the U.S. As we all know, the elderly and those individuals with comorbidities are at increased risk of contracting this virus. Nursing home residents are front and center of that risk population. In the long-term care community of providers, we anticipated it wasn't if, it was when a resident would become affected. Chateau Center's planning and response to COVID-19 has been a multidisciplinary approach and has been a very coordinated plan following guidance from the Centers of Disease Control Prevention, the Illinois Department of Public Health, and the DuPage County Health Department. This week before, the week before last, we proactively initiated and implemented increased infection prevention strategies and practices prior to the identification of any case. These included symptom screenings of staff and residents, enhanced environmental cleaning and disinfection, and visitor screening and restrictions. As the number of COVID-19 cases has increased in Illinois, one of the residents at Chateau Center has been diagnosed with COVID-19. This individual is hospitalized and is currently in stable condition. We believe that because of the proactive approach to this crisis, we were able to identify this quickly, and on this past Friday, this case was confirmed. We've been working very closely with the DuPage County Health Department and the Illinois Department of Public Health to promptly identify and monitor individuals who have had recent contact with our individual who's been diagnosed to prevent any further spread within our facility and the community at large. Before I end, I would like to extend a special note of thanks, first and foremost, to the dedicated staff of Chateau Center and the staff of Extended Care who have continued to work diligently to ensure the safety and provide exceptional care and services to our residents and the care that they have grown to depend on. I would also like to thank the staff of DuPage County Health Department and the staff of the Illinois Department of Public Health. And now I will introduce the County Board President, Mr. Groen.
Thank you. As we continue to respond to this ongoing issue, I wanted to let you know that I will be signing a disaster proclamation for all of DuPage County effective this Monday morning. This disaster proclamation is critical as it puts our emergency operation plan into play for everyone here in DuPage County. This comprehensive plan provides coordinated resources and specific assets allocated to DuPage County to aid in the ongoing response and recovery of COVID-19 that is affecting much of our nation. And finally, this disaster declaration for DuPage County aligns with the current state of Illinois disaster declaration so that we can coordinate our activities in that regard. We are taking every possible action to mitigate the impact of COVID-19 on our communities. I ask each mayor or village leader to continue to reach out to the county. Our health department and our Office of Homeland Security and Emergency Management are available to help you coordinate individual municipal responses. Together, we're dealing with many changes in the way we conduct our lives and our business. Starting this week, many employees will be working remotely and students will be learning from home. I've talked to Comcast representatives, Comcast, an internet provider, who have pledged to make high-speed data service available for 60 days for low-income families who presently do not have the company's internet service in their homes. Additionally, Comcast has opened its Wi-Fi access points across DuPage County for subscribers and non-subscribers alike at thousands of points located throughout DuPage County. And like the utility companies, Comcast will not disconnect service or charge late fees during this time. Families should be able to conduct business and learn without interruption as we follow the public health guidelines and stay home as much as possible. Giving DuPage, our volunteer network in the county, is organizing and working to organize volunteers and needs for volunteers. There's a considerable number of young people that have called our offices asking for an opportunity to pitch in and help. Very gratifying. Connecting these young people with the authorities in our health department and the county of DuPage is one of our missions right now. So Giving DuPage is our volunteer network in the county. And so I encourage people, young and not so young alike, to contact them at givingdupage.org. And that's one of the more gratifying experiences that I've been able to be part of thus far, the folks that are pitching in. And so that leads me to my next point, and that is I want to take a moment to thank the many community volunteers that I've seen online, on social media, offering to help the elderly and folks that are disabled. There have been countless posts by young people, college students, caring adults, offering their time and energy to run errands, pick up prescriptions, and groceries. This is really a wonderful example of our community coming together, and I want to thank all of the folks that have expressed that spirit of let's pitch in and help. So thank you, DuPage. And please keep on taking care of yourselves and your neighbors. I appreciate all the goodwill and generosities our residents have demonstrated, although I'm not surprised. You are what makes this community such a wonderful place to live and work and raise a family. Together we can get through this challenge. This is a period of time that we come together. And if the cooperation of social distancing, maybe staying home and spending a little time with grandma, reading a book, if these little changes in your lifestyle lead to helping one person, save one person from contracting this virus, or saves one life, then isn't it worth it? Isn't that what we're all about? I'd like to acknowledge our county board members that are here with me, Liz Chaplin, Pete DeCiani, Bob Larson. We have Mayor Frank Trilla from Willowbrook, our leaders from the health department, and just want to thank everybody for pitching in and doing what we do best as a community. So at this point, I'll pitch it back to Karen Ayala, and we'll be happy to try to answer some questions, I think.
So a few final points. Again, a reminder, this virus is thought to have spread from person to person, mainly between people who are in close contact with one another. And again, we're defining close contact as individuals who are 6 feet or less distance between each other for more than 10 minutes. We have already begun to see evidence of community spread in our communities and in our region. Spread through respiratory droplets that are produced when an infected person coughs or sneezes. Those droplets can then land in the mouth or noses of people who are nearby or possibly be inhaled. I certainly understand that this is an unprecedented time. We have not been here before, and it is extraordinarily uncomfortable. And yet, we are equipped with steps that we know will make a difference. First, avoiding close contact in large crowds. People must stay home. Second, washing your hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, going to the bathroom, and before eating and after preparing food. Second step people can take, clean and disinfect. Practice routine cleaning of high-touch surfaces, counters, tabletops, doorknobs, bathroom fixtures, phones, keyboards, etc. Third step, avoid touching your face, nose, eyes, and mouth. Stay home if you are sick. Avoiding close contact while you're sick, even in your home, confining your space so that you don't inadvertently infect other family members. covering coughs and sneezes with a tissue or with your forearm. Once again, if you are sick, please stay home. And if you must go out to receive medical care, you should wear a face mask when you're around other people. Equally importantly, if you are not sick, you do not need to wear a face mask, and we're really asking folks who are not sick to preserve the mask supply for individuals who are in need. Finally, if you are feeling sick, please contact your primary care physician for directions on how to proceed. Do not simply walk into the doctor's office or the hospital if you have symptoms consistent with COVID-19. DuPage County Health Department's coronavirus page has a compilation of information. I would invite folks to visit that at www.dupagehealth.org/590/coronavirus.information. If you go to the DuPage County Health Department website, there's a button that will take you to that page, or call the Illinois Department of Public Health's coronavirus hotline at 800-889-3931. Over time and history, we have had many examples of emergencies bringing out the best part of ourselves and our community response. This is simply one of those times that we must challenge ourselves to do so again. Because in closing, I want to emphasize what the chairman said earlier, that we all have a role to play in assuring the health of our residents, the health of our families, and the health of our communities. With that, I'll open for questions. Certainly. So we have had staff on site at the locations involved since Friday evening. They have worked pretty much around the clock to identify both healthcare providers as well as visitors or other individuals who may have come in contact. Again, this is a routine part of every communicable disease investigation that we do. Certainly, this is highlighted now because it is COVID-19, but this is something that we have decades and decades of experience in doing. So those have been done. We anticipate that we will have reached out to all of those individuals by today, the end of today.
If you have a question, please raise your hand. We'll bring a microphone to you.
Just a minute.
If they're showing symptoms and where can they get tested? What's the procedure for that? Those who've been in contact with this person.
The people who have been in contact with this individual have been provided with specific information on how to proceed. So they are given that information both verbally and in writing.
My name's Nancy. I'm with WBBM Radio. Just to be clear, we can assume that because this woman's in a long-term care facility, that she was in fact infected by someone else. Then, like, this is a community contact.
Yes, that is our understanding.
And do we know if that was do you know at this point if it was a staffer or a visitor?
We do not know.
Have you made any efforts to isolate the staff that were working with her?
Absolutely. That's part of that initial investigation. And those individuals have been given the guidance that we have from CDC and IDPH for next steps, to either self-quarantine themselves or to be tested.
The symptoms don't show up for like 2 weeks. So then is everybody, because people can be asymptomatic like we've heard for a while, does that mean that everybody who was working then is supposed to isolate for 2 weeks then, or?
I don't believe that we have confirmed that asymptomatic spread is occurring right now. However, we do stratify the risk of individuals. So if it was someone who just simply walked down the hall of the wing of the facility, their risk would certainly be different than someone who gave hands-on care to this woman. And so we're making recommendations based on those stratifications.
Can you say roughly how many people then you have in that strata that would be the most close in contact with her that are now going to have to self-isolate or test?
I don't have that information at this time. What we do know, though, is based on the epidemiological investigations that have occurred, that an average of individuals who come into contact with a case is around 90 individuals. Now, this individual is in a long-term care facility, and so that may impact that number somewhat one way or another. But so far in the U.S., the number of contacts that have to be tracked down and investigated by public health staff is around 90 per case.
I just want to clarify, this is a case of community or spread, or do you know how this happened?
We do not know how this happened to this resident. However, since she hasn't traveled or apparently had contact with another COVID case, we are conjecturing at this point that it is another example of community spread.
Has her family traveled at all, or?
I don't have that information to share.
Karen, on the testing kits, I understand that they're not in yet. When do we expect those testing kits for this particular virus?
So, good question, and it provides me with an opportunity to explain when we talk about testing kits. Currently, the tests are all being run at this point through the State Department labs, Chicago, Carbondale, and Springfield. What is involved is individuals who have been deemed appropriate for testing reach out to their medical providers, of course ahead of time, and then when they're escorted into the facility where they'll be tested, just a typical swab is performed. Those swabs then are packaged to maintain the integrity of the sample as well as protect individuals handling those samples. And then those are submitted to state labs. So as far as testing kits, we have not seen what the private market is going to be providing, but that's the process that we currently have. And we have had every person tested who we have recommended for testing.
Because we're told that sick people shouldn't show up at hospitals, can you say if the woman who was tested positive, is she staying in the long-term care facility or has she been moved to a hospital?
She is hospitalized. And it was because of the astute clinical, both the identification at the long-term care facility as well as their work to assure that this individual was transported safely. I can't commend the staff of the facility enough. They worked with us. We were able to very much limit the spread and the contact of this individual with healthcare workers.
Just a tangent here. We saw a lot of people, young people, out at bars yesterday. Because this is an older and more vulnerable population, and maybe they're not, go streaming or anything. Do you have suggestions on people who might be more at risk and what they can do to keep themselves safe, but also pass the time?
Hit the books.
There you go.
Prepare
There
for
you
their
go.
job interviews. No, look at we're all my daughter went downtown and stayed with some friends in a small environment, and she told me that she didn't go out to any of the bars, and so I believe her. So yeah, I think it's incumbent upon the young people to pitch in and help here. I really do. And I think there is a sentiment out there where folks believe that, this is some kind of overreaction. Look, all I can tell you is that what we're doing today and what we have been doing since this issue came to light in the end of January is do exactly what we are advised to do by the experts in public health. We don't want to overreact. We don't want to underreact. Somebody said that in these kinds of situations with diseases that spread, success always looks like overreaction. And so with young people that are out and about who feel they might be immune to this, they can still carry the virus and they can still contribute to the spread of it. So I would appeal to my young friends and community to please pitch in and help, observe the recommendations of social distancing, try to be part of the solution and not part of the problem.
But just to clarify, for the older people, so those who are supposed to be isolating or who may be at more at risk, what are there things they can do to keep themselves entertained and not expose themselves by going out?
I don't know. I mean, what can people do when they're sort of in small, settings with small number of people, get to know each other a little bit better? Read. I mean, I'm not sure I understand your question.
Well, just because they're more at risk, that chances are there options? Are there things that, I don't know, the community television or other things that you suggest they are doing so that they, since it appears that maybe it's incumbent on them to stay indoors, things they can do?
Yeah, I would hope that friends and neighbors and family would stay in touch with loved ones, and I would hope that the community would take, sort of stock and inventory of the people that are maybe alone, and that's part of our appeal here today. We're trying to engage younger, healthy folks that have reached out to the county and said, what can I do to help? We're trying to connect them through our givingdupage.org. We have a wonderful, energetic person, Shafali, who's working overtime to try to connect folks that want to help deliver groceries or pick up prescription drugs, offer a little bit of comfort and companionship for a period of time. So this is, with every crisis, there's an opportunity for communities to come together and to really demonstrate our commitment to sort of a higher calling. And so I think this is a chance for us to be good neighbors and to reach out and to try to help. And sure.
We have time for one more question.
Thank you. So are we planning on, I saw some hospitals in the city are setting up tents and like triages outside of the hospital so that people that believe they have COVID-19 can get examined outside of the hospital. Do you see any of those facilities setting up in DuPage
I'll defer to the
County, or-
medical experts, but based on what I know, that's not necessary at this
right now at
stage.
this time? Okay. Yeah.
I think that many of the outdoor kind of interventions are more targeted toward testing. So it's testing people. And again, that although our supply of tests has been adequate to date, if we start encouraging people to get tested now, we simply won't have enough tests. We absolutely, once the testing supplies are more available, we would be very happy to expand access to those.
Great.
Again, though, not everyone needs to be tested, which is another important point. If you are having symptoms, though, once again, please contact your doctor before you go in for a test, or contact the hospital before you go into the emergency room. Thank you.
One last question? Sure.
So the question is, what are the criteria? What are the symptoms? So primarily it is cough, it is shortness of breath, and it is fever, which is defined as 100.4 degrees or above.
Once again, I'd like to thank you for joining us here today. As I mentioned earlier, we'll have more information as further updates, and more information is available. We'll have further updates. Thank you.